Gerardo Zaguego, Joe Delron Ujets. Just a little while ago, we gave the what we thought would be the daily update from the COVID-19 task force. At this time, we have some breaking news, and with that, we'd like to invite the Executive Director of the Kateri Memorial Hospital Centre, Lisa Westaway, to let us know what the news is.
Thank you. I'm here today to advise the community that we had a first positive case of COVID-19 in the community. In fact, this case is a physician at Kateri Memorial Hospital Centre. I'm also here to tell you some good news about this case. So I just very recently got off the phone with Public Health. I would like to give you some details regarding this case. So this is a physician who is in New York City from the 7th to the 9th of March. She worked at Kateri Memorial Hospital Centre on the 11th. Her husband actually began to develop symptoms and self-isolated on the 15th of March. And her as well, because her husband exhibited symptoms, she canceled her clinic at the Kateri Memorial Hospital Centre and also developed symptoms on the 17th. She tested yesterday and received a positive test result today. After speaking with Public Health, we have confirmation that the virus is only contagious 24 to 48 hours before exhibited symptoms. Therefore, symptoms were shown only on the 17th. She was contagious up to a maximum as of the 15th, and she had last worked in the community on the 11th. Therefore, there is absolutely no need for contact tracing by Public Health or by KMHC in any way. There is no risk to our population, nor to our patients, nor to our nurses and other physicians and or residents. Everybody is okay. But the reason why we wanted to come and give you this information was to pass on some important messages. The first message is with respect to travel. This was a visit to New York over 2 days, and it was a transmission as a result of that visit. We reiterate, I know we've said it before, we say it again, how important it is once you travel here from New York, from outside of Quebec in any way, that you self-isolate for the 14 days. We also want to use this opportunity to give a message to the community that this is real. This is not a joke. The way we're preparing is to limit the contact as much as possible. So let's take this case for an example and use it as if the dates were different and that there had been contact. The first thought in perhaps a nurse's mind would be, did I see my mother recently? If we are following the measures that we're asking you to follow, meaning limit your contacts outside of your household as much as possible, very limited contacts, then even when we do have positive cases, and we will have positive cases, we'll be able to have control over the amount of people that we've had contact with. And that is the goal, is to limit the transmission as much as possible, slow down that transmission. It's not a stressful situation that we're going to have the virus. The virus will come to Kahnawake. We don't want to cause panic. We don't want to cause alarm. We just want to be prepared. And that's why I thought it would be important. Our COVID-19 task force thought it would be important for us to give you this information immediately. Of course, in all transparency, we will continue to provide these updates. And we are happy that the result at this point is that we don't have any further actions to take, but we are prepared when we do have to take actions, and we ask that you each make those preparations as well. So thank you very much.
Thank you very much, Lisa. Lloyd Phillips, Commissioner of Public Safety. I just wanted to also reiterate a few comments that Lisa made, that it's not a matter of if the virus reaches our community. It's a matter of when, and this is based upon public health information from all the appropriate medical authorities that are out there. And again, it's a matter of minimizing the impact And if there's a certain amount of people who will get the virus, you want to spread it out over a longest possible period of time so that if they require any type of medical assistance, the medical assistance is available to them. We also want to provide this additional update this afternoon to squash any rumors, because we know if information goes out there and somebody hears that a physician was positive or somebody in the community was positive, you know how things are going to progress. If and when somebody's positive and we have information on that, we will gladly share you that information. Obviously, we're not privy to names, and this medical information is people's privacy, but we could confirm or deny that information. So we want to make sure that people get the factual information. So we always want to keep referring people back to have the COVID-19.kmhc.ca website for medical information. Kahnawake 911 on Facebook are two sites that everything that goes on there is filtered, it's reviewed, it's factual, and we put it out. So that was important, because we know this information hits close to home. Person was in the community, but we are fortunate at this point in time that the information that Lisa had just given, that there is no immediate need for any additional measures at this point. So we'll keep the information there for now. And maybe as a final point, because this was asked online a little earlier on why don't we have any testing in the community. First of all, Quebec is ramping up their testing clinics throughout the whole province and throughout the region. But the thing is, no matter who does the testing, you have to send that off to appropriate people to analyze it and do the proper lab work to ensure whether it's negative or positive. So we don't have those facilities here in the community. So even if we did have somebody take the swabs and whatever, we still have to send it out to another location. So that is a short answer to why we're not doing testing in the community at this point in time. No, and that's, yeah, thank you. And also, you have testing facilities here, and then now if there's people who are there who are having symptoms, you're actually congregating all the people in the same area, increasing the chances of further transmission for people who maybe only have some symptoms of the regular common cold or common flu, now coming in contact with people who actually may have the virus, increasing the chances of further transmission. And that's going to be directly within our community. So there's multiple reasons for it, why it's not happening in the community. But we want to ensure that the community is going to be aware that there are places where you couldn't go to get tested, but you have to be referred to go there. And there's numbers in place. We know people have a lot of frustrations regarding calling the 877-644-4545 number, waiting for hours and hours and sometimes being knocked off the system. We were assured that system is going to be updated, revamped, more manpower, human power to man those phones. We're also looking at options internal to the community on how we could use something for our region or for our community. So we're moving forward. Every day is a new challenge. Every day is a new nuance to what's happening in this pandemic. So with that, I'll leave you with that. A good night, and we'll see you again tomorrow. Thank you.
Watkunuradu, and welcome to today's COVID-19 Task Force briefing. It's been another busy day, and we're not going to waste any time, get right down to it. Lloyd Phillips is the Commissioner of Public Safety. He has some announcements to make. We'll also be joined in a little while by Derek Montour, the Executive Director of Secwépemc House Community Services. But right now, Lloyd Phillips with our update.
Good afternoon once again. Thank you for joining us. Again, a very busy day for the Kahnawake COVID-19 Task Force. We finished a meeting just a little while ago, and we had representatives from Kateri Memorial Hospital Center. We had the Education Center representatives here, as well as PK's, Kahnawake Fire Brigade Ambulance Service, MCK, and of course we had Public Safety Division representatives here. We had a roundabout discussions, and just to get an overall status on the community, on where things are, and I'm glad to report that things are being managed very satisfactory, very good, and everything is being managed as good as could possibly hope for. What I also want to add is that all the community organizations are in the process and will be soon, if not already done, implementing procedures in which they're going to be providing essential services only. So it'll be minimal staff within all the organizations, but at the same time to ensure that they are providing essential services to the community to minimize any inconvenience. The same thing goes for if K103. I was speaking to the program director over there a little earlier this morning, and he also mentioned that he's going to be going down to this essential staff at K103, but they are always going to be available to the community, to the task force, if there's a need to have any updates immediately given to the community. So we do certainly appreciate that. At this moment, there is no major new directives that will be coming out of the EOC or the COVID task force. What we are going to be asking is the MCK to start looking directly into some type of emergency support, financial support to individuals who are going to be impacted or by the recent closures of various businesses within the community. That's going to be a directive that they'll be following up with starting tomorrow. Matter of fact, some of the preliminary work has already started. But we're looking at what's happening across the country. If you heard the news today, the Prime Minister had announced a stimulus package and a support package for everybody across the country. How that impacts on our community will be determined. We'll assess all those programs as they come available. But we're also looking at a Kahnawake specific type of process to ensure we bridge that gap between now and when or if there's available support from the Prime Minister's announcement made today. So that's something that we're not taking lightly. We understand decisions made that impact individuals can hurt, and we're going to address that as quickly as we possibly can to at least minimize some of the impacts. One of the other things I want to mention today is if you watch the news, they are going to be closing the border to all non-essential travel. So that's something that people may want to take note of, although there is obviously a travel ban in effect for leaving the province, but individuals who are working in New York and such, mainly in this case iron workers, you have to assess on what that means to you. We don't have all the answers as of yet, but will somebody be able to cross back and forth across the border is a very big question mark at this point. When they talk about for essential services or essential transportation, they're usually talking about large economic trade, tractor trailers and stuff of that nature crossing the border. How it impacts on individuals is yet to be determined, but we'll definitely keep tabs on that. But there may be a significant impact on your ability to continue to cross the border. Keeping in mind, this is an issue, not of a political nature on how or who can cross the border. This is an issue of public safety. The virus, doesn't care if we're Mohawks or if you're a Canadian citizen or American citizen. This virus is impacting everybody, and that's why some of these measures are being taken, and we have to assess on how it's impact our community directly. Also, I had some questions over the past couple of days about how impacts on other businesses in the community. And at this point in time, this is obviously subject to change. There is no additional directives for other businesses in the community, other than for them to take note that the whole social distancing, which is information is available in the community on keeping your space between people, being extra vigilant in terms of cleaning the surfaces that people touch often, making sure your personal hands are washed on a regular basis. Those are things that are being recommended at this point in time. If things evolve, certainly the community will be notified as quickly as possible. With that said, I'll turn it back over to Joe just for a minute, and we have other speakers coming up. Thank you.
Right now, Lloyd, and as Lloyd mentioned, social distancing is important. That's actually one of the reasons why we're not standing together and just doing interviews and asking questions. It is a very important issue. Right now, one of the organizations who, of course, is impacted and will be assisting as time goes along here is Kahnawake yet again has community services. The executive director, Derek Montour, is with us now, and he'll give us an update on what they have been doing in these last several days and hours. Derek?
What can waradu? Hariyanas Jujat. I offer my greetings to all of you as my brothers and sisters. I pray for all of your health, your happiness, and your love and your laughter throughout these difficult times that we're all experiencing. I wanted to give an update on all of KSCS operations. I'm going to give a summary because it has been a fluid motion for the last few days and a lot of changes as it's evolving. So I'll tell you where we're at right now. First and foremost, KSCS's operations during an emergency services is to handle 5 main priorities. The first is shelter, clothing, food, registration and ID, and psychosocial support. In this particular emergency, which is the pandemic, shelter is not a primary concern, but we are expecting potential shelter options. With that, the main issues would be such as a quarantine shelter or those types of facilities. Obviously, we're not recommending close concentration of people, so the only time a close concentration of people would happen is if people already have the virus and are then needing to recover in that process. We will take the lead from the KMHC if that is an eventuality. For clothing, that's not a major concern for us, so we don't expect to put any emergency operations related to clothing in space. Registration and ID, again, is not a major concern at this point because most of the registration or ID for people that are sick are going to be going through the KMHC or other health facilities to become identified if they have the illness, to get tested, and they would have registration. The biggest request I would have for community members in respect to registration ID is always make sure somebody knows where you are. Particularly if you go out to other locations, let's say up north, or you're going outside of the local area, of course within the province of Quebec, but always make sure people know where you're at so that we can always keep track if messages need to be passed. For registration and ID, as I said, it shouldn't be a big deal. Clothing, not a big deal. Shelter, not temporarily. For food services, we are expecting to ramp up. I've already assigned one of our staff members to take on the coordination of emergency food services. That coordinator is going to be Lloyd Phillips. That doesn't mean community members should contact that person. That's our internal coordinator. So she's already been tasked with starting to look at the supply chain and make sure that's solidified, looking at purchasing of services, storage of food, preparation of the food, delivery of the food. So we don't want, again, people congregating. So we're looking at delivery methods. And then finally, an intake process. So how can people register? What would be the system? How do we get that set up? Of course, we're looking at alternatives. Do we want to look at, let's say, a voucher so that you could go do that on your own? Or do we do it as a delivery process, kind of like a extension of Meals on Wheels, for example? So we're working all the mechanics of that yet. We know that we suspect it will be coming. Community members may be already at that stage or all not. So we're gauging that and we're trying to ramp it up as quickly as we can. We're going to give the community more information. I want to keep referring people to those key websites of the COVID-19 KMHC website or the Kahnawake 911 Facebook page. All of the information will keep being put through there. The last main emergency services that KSCS is responsible for is psychosocial support. Of course, we've already taken measures to triage our existing clientele. So those who are already existing clients of KSCS, we've been contacting you. We've triaged where some who we've been able to determine there may be a lower psychosocial support need have been asked to postpone cases. Those who have been a medium priority, we're going to be looking at, if not already done so, setting up counseling or other types of support through video conferencing and other, let's say, telephone sessions. And then finally, those higher need let's say, crisis types of cases, we're still looking at face-to-face communication. In any kind of face-to-face communication for any of our facilities, of course, the screening methods are going to be coming into play. Less and less, perhaps, are some of the travel questions, but those key questions of, do you have a cough? Do you have a fever? Have you traveled in the last 14 days? And in particular, have you been in contact with anybody who has those symptoms are going to be important. And it's to ensure we can still offer services, but we can do it in a way that we can ensure your protection and the protection of our staff as well. So Cheryl Zachary is looking at managing the emergency psychosocial support, of course, with the support of the entire team. We have a variety of let's say, psychosocial support needs, whether it's the psychological services, mental health support, youth protection concerns, or a combination of those. Obviously, we don't have group home support, or I should say group therapeutic support, so it's all going to be done individually through ideally video conferencing or telephone, but where necessary, we'll do face-to-face. And again, that information we're going to put out on those websites. The final thing that's related to psychosocial support is, of course, prevention type. Everybody is feeling anxious during these times. Everybody is dealing with questions and lack of understanding, and as a natural course, all of our anxiety comes up. The key people that we're concerned about are those who have anxiety issues or other things. Of course, we're seeking support, but everybody has those issues. So don't be shy or ashamed or not to access that. We're going to get information out on those websites to help address some of those questions, even, for example, to how to talk to your children about COVID-19 and what things should you say or not say, and how should you try to ease their concerns. Everybody's going to have these concerns. Let's start being prepared for ourselves. The final things I want to mention are what other KSCS essential services mean. Lloyd had already mentioned that most of the community is going to that. KSCS has taken a decision of this morning to essentially affect essential services only. So for us, the first, of course, is psychosocial support or mental health support. Those food or clothing, registered ID or shelter, which are then, delegated tasks in an emergency. Residential care for us is obviously a concern for both our elders and our independent living center. Those are now closed facilities. If you have family members that are in those facilities, of course, we're asking you to not visit at this time, if at all possible. If there's emergency need, to go through our staff so we can properly ensure protection of you, of them, of our staff. We want to make sure we reach out to them, so I encourage you to keep up with phone calls, even get back to writing letters and making up videos. Be creative. We want to make sure we stay connected in these trying times. This may last longer. Everybody's saying it longer than 2 weeks, so we want to start building in now methods on how can we communicate in a good, positive way. We're here for each other. We're brothers and sisters in every respect. How do we ensure that we get those messages across? Of course, FSRS, our Family Support Resource Services for our community members with special needs. We're still reaching out to them on a daily basis. If they had needs, how can we support? Maybe supporting through groceries or helping up with needs. And of course, our home care, getting to our elders or those in home care needs and supporting that. Volunteerism is always a big thing in Kahnawake. We know with crisis events, those volunteers come up. You know, we talked about it today, and the MCK is looking at initiating that emergency volunteer board so that you can submit your name. There may be opportunity you can help with the food services or other services that may come up. Please, if you're willing, give your name in. We'll ensure all the protection we can, but there's going to be need that we're going to experience, in particularly as this continues. And we have to remember, this is a pandemic. It's going to continue, and it's going to happen again. It's the reality. We had many pandemics in the past. There's going to be pandemics in the future. Let's learn from this one, get our gears in place so we know what to expect, so that the next time it hits, we know what to roll out. And because it's going to happen again. This is the state of our world right now. The final thing I want to mention, of course, is access to services. We have those 877 numbers and those others. Yes, I know that they're overwhelmed. Yes, I know the waiting lists are long. Please try to be patient. They are trying to put measures in place to improve the wait time. But if the emergency is need, You're going to be able to access KSCS. We're going to triage so that we can try to ensure we address those high priority community members first, but we will try to get you or at least point you in the right direction. The second thing is screening. At any time, respect those distances, but don't be shy. Let's all get into the habit of asking each other, hey, have you been traveling the last 2 weeks? Do you have a cough? Do you have fever? Have you been in touch? It's not a bad thing to ask. There should be no shame in that. And I should not get upset because somebody asked me that. I should be used to answering those questions or no, because the whole thing is we want to protect our community. The numbers are out there. We can find those mortality rates and other stuff. This is a reality. We were expecting and are expecting our community to get the virus. It's going to happen. It's normal. We just want to spread it out as best we can and then put our services in support for it. So my final words is KSCS is here for you. We're engaging all our services. You know, we're going to be giving updates through here. We're a key member of the Emergency Operations Center, but we are available for your assistance if need. Thank you for your attention, and I wish all of you the best. Remember to hug your family when you go home. Nyawa koa.
All right, Nyawa Derek. On behalf of the Mohawk Council of Kahnawake, I'm Joe Delarone, I'm the press attaché, part of the public relations unit. There was an announcement made late this afternoon that MCK is putting all non-essential services on hold during this pandemic. Now, what that means is that, and people are going to ask, well, what does it mean? Does everything stop? Certain things will be continuing. Of course, peacekeepers will continue doing their job, the fire brigade. Even things like animal protection, because people love their animals, and they're going to say, what, are we closing that? That will continue to be in operation, and along with a lot of the services. As we have a lot of clients who are, collect social assistance. There are measures being put in place for the safety of the clients and the staff. So there will be a press release issued shortly where you can see the details on how you can still access the services. They're asking basically people to use the telephone to get their information there. They will have staff in the building, of course. But it is an essential service. People are depending on it. They're also going to be available for people who don't have, if you're not collecting EI, for example, employment insurance, some jobs don't have that. They're looking at ways of assisting. So pay attention in the days to come as more and more information becomes available for that. Housing, there still will be client intake. They will still maintain all of the rental units, the social housing rental units. That's going to continue. But there are going to be certain changes in terms of payments, for example. So again, stay tuned in the days to come as any changes will be made, given to the community. Public Works, they're going to stay, of course, 24/7. When you talk about water and sewer services, that's not going to stop, and that's a very high priority. Safety and health is it. From the Labor Office, they will maintain a small staff, and they're going to continue to process Mohawk self-insurance claims. Also, employee resources regarding benefits. If someone actually gets COVID-19 and they're working and they need some information, they're going to be helping in terms of that. And so basically, just check out the websites. They'll have all of the information for you. There's a lot more. I'm not going to go through the entire press release here, but go to the COVID-19.kmhc.ca site for health information. And for other information, of course, Facebook, just check us out, Kahnawake 911. And for those who may be catching this just now, if you want to hear a rebroadcast of this, it'll be on K1037 in the next little while. They're going to play the recording of this back in its entirety. So once again, we've made the commitment from the entire COVID-19 task force to bring you updates every day. We will continue to do that to the best of our ability. So once again, we wish everybody all the best health, and we'll see you next time. Yao koa.